Welcome, Daniel. You're basically you're a collaborator in our research network, CPET, but besides on sustainability, inclusiveness, productivity, and equity in the transformation of Swedish working life courses, but you also have a life besides this, more or less a bigger part of your life as an associate professor in the public health sciences at Karolinska Institutet, and that's what you will probably report about. I mean, our collaboration is about our funded research networks, which have some parallelities and some intersections. Basically, working on late work life prolongation conditions and consequences, and this is our common ground. And I'm curious to hear your presentation today about building a healthy working life course, inequalities, and the role of working conditions. Please correct me if I or presented something wrong about you, or if I missed something you complete. And I simply hand over to you.
Thank you. Yes. I think Andreas presented me. So I've been working at Karolinska Institute in Stockholm for many years, and we got this program grant 3 years ago, something, and since then, or almost then, we have worked together with Linköping University in this CPET network. So I've probably met some of you in the audience here. So I'm working in this unit at Karolinska called occupational medicine, and so what I guess I bring into this network and also with this presentation is are they working conditions or that perspective? And also,
je microfoon aan, weet je wel. Dus ik dacht, voor de zekerheid, voordat ik weg.
Someone has to mute here. Okay. So that's that. So I will do a presentation of my work or our work here within this program, but also in our research group. I will tell a little bit about what we do and what we've done, and also a little bit about how we investigate working conditions in the life course, within the life course framework. And since I've never really presented these slides and some of the things here, so I'm welcome any interruptions here if they're about clarifications. So please ask questions. I think you have to, in case you do, shout out loud, because I will not perhaps see your hands up. But if there is something that you just don't understand, you're welcome to interrupt me. The title is Building a Healthy Working Life Course, Inequalities and the Role of Working Conditions. And so both our group and Andreas' group, we have this life course and inequalities perspective on our research, and you will see that in this presentation as well. So the background to the research program is of course that because it's about late working life. So so we have these demographic changes. We have more old people or aging populations and fewer younger. So we and even more the politicians, they realize we have to extend the working life or prolong the working life, because otherwise it will be too expensive for our societies. Yeah. So how should we do this, and what are the obstacles to prolong the working life for people, to keep them longer in the labor markets? Yeah, one problem is that we know that after 50 years of age, many people do actually leave leave work or are excluded. They have problems to stay in work because of health problems. This is also something that might not decrease with a longer working life, because then maybe people they do have chronic health problems from this age, and if more older workers are in the labor market, then also more people with chronic health problems with chronic diagnosis will be in the labor market. Yeah. At the same time, since 15 years in Sweden, for instance, we have had social insurance reforms, having led to drastically reduced opportunities for the workers to exit the labor market on disability pensions. So we had much more of that previously in Sweden, and also in other countries, I think, in Europe. So this is a big challenge for some workers, or in some parts of the labor market, and especially for the low educated workers, we think. We did a study published quite recently, or a year ago, that you see many names from our unit here. This was actually related to also to a previous research program that was kind of in which a lot of data infrastructure, so to say, was built up. So we did this study of before and after social insurance and retirement policy reforms in Sweden happened. So we looked at the low and high educated and compared how they left the labor market before and after these reforms. So this is also part of the background here. So I just want to show you here that what we found here was that we can compare here cohort 1 and cohort 2. They are before and cohorts of the same age, 61-year-olds that are at these ages before and after the reforms in Sweden. So what we see here is that if you look at the cases and percent here, so disability pensions, they are much fewer in this second cohort after the reforms, much fewer, and they are go down even more in the higher educated people. So then, because you take the ratio of the probabilities here, or hazards of leaving the labor market before age 65, then they slightly increase, because the low educated take fewer but relatively more of the disability pensions after the reforms. More interestingly, we see that to leave the labor market with an early pension with income but not a disability pension, that is actually more common than after the reform. And then the low educated do this to a somewhat greater extent, which was not the case. It was the opposite before the reform. So this is interesting, and also the associations with leaving the labor market on an early pension without income is the probabilities here, they are a little bit more increased in the low educated here after the reform as compared with before the reform. And here is a more of an ambiguous picture. And on this this table is, I don't know if you saw that I changed the table, but so these are the women. I think I can't see here on my own screen. Maybe you can't either. I think it's the women. So, but we have the same patterns in the sense that inequalities, or the low educated tend to leave the labor market to a greater extent after the reforms, as compared with the high educated. So the high educated seem to be kind of in relative terms, the winners of the reforms. They find work somehow after the reforms as well, which the low educated don't do to the same extent. Okay, so more of background. So studying the effects of physically and mentally demanding working conditions on low educated people's chances of prolonged labor market participation is therefore warranted. We want to understand if these differences between the high and low educated workers, if they leave because they have, if the low educated workers leave because they have worse working conditions. It may sound self-evident, but it's worth studying to what extent this is. Anyway, we know that poor working conditions are more prevalent in the low educated workers, but we also know that working conditions, the poorest working conditions, are most prevalent where educational requirements are lowest. So in other ways, the low and high educated workers are also not comparable. So maybe there could be problems in the low educated workers that of working longer, that problems that are not related to their working conditions, and so this could be another explanation. This is from a paper that I will show you a little bit more about in a little bit later. But so this is just a graph showing. So the E here is the educational levels, and then we have W, the working conditions, and then disability pensions, because this study was about disability pensions as the outcome. But we also have these potentially confounding factors that are actually present before people are finished their educations, that could select them both into educations and working conditions, and also increase their risk of disability pension eventually, and possibly in some kind of independent way, or independent of the other factors in this graph. So what working conditions could be of interest, could be more common in the low educated workers as compared with the high educated. So we have, of course, the heavy physical workloads in manual jobs. But we also have low decision authority, which means that you have a worker with low decision authority have less influence over their work tasks. So they are not part of the planning. They can't. They don't have like the authority of taking decisions of how to work, how to do different tasks during the working days or during the work week. Which the high educated workers have. Yeah, with us as an example, we can kind of to a much greater extent decide how to work during a work week. Also, the low educated have less of skill discretion or skills utilization. So they have more of routine work, which give little room for kind of natural skills development in their work. So while they're high educated, they kind of naturally learn on the job and develop and increase their skills and their skill sets during their careers. So less of routine work, which could then affect workers differently in the labor market and become obstacles to some the low educated workers. We also have noise and vibrations that are more exposure to noise, exposure to vibration when working with tools, for instance, that are almost only seen in manual jobs. We have exposure to chemicals and particles, and so on. So these various exposures or working conditions, they are differentially distributed among the low and high educated workers on the Swedish labor markets and in any industrialized labor market. Okay, so how to measure working conditions in our total population studies? You can't go out and ask and hand out questionnaires to all Swedish workers. So how do we do this? Well, we use something called job exposure matrices. And I take as an example, and I will focus on physical workload or the ergonomic job exposure matrix in this presentation. But we have done this in Stockholm here, trying to capture many of the dimensions of exposure that I just talked about. So I show you here how an Excel file looks, and I had to use an international one as an example here, but we just because for you to understand the occupational titles here or being able to read. So this is one way a job exposure matrix could look. So what we have here in the left-hand column here, we have occupational occupations, and they're on a 4-digit level. And then we have the occupational titles. So many occupations here. So you only see some of them. And then you have here categories of ergonomic exposure. So you have heavy lifting here, and you see here, for instance, some of the electricians have very low exposure to heavy lifting, while hunters and trappers are considered to have, and also floor layers are considered to have a lot of heavy lifting. And you see here different aspects of physical workload. Here you have working with hands above shoulder level, which is can create some problems with musculoskeletal disorders. Forward bent postures. This is how you kind of the postures you're working in. That could be creating problems for you as especially as an older worker. Fast breathing. This is more related to workers' fitness levels. Okay, and so how in the Swedish versions of the job exposure matrix, we have for each occupation a mean value of exposure, I mean, we have used in Sweden the work environment surveys that are distributed every second year in samples of Swedish workers. So they answer about all different. They asked a lot of questions about their working conditions, and then they're also answering about their physical workloads and different dimensions, as you can see here. So in the Swedish ones, we have the respondents, the average value of responses linked to the respondents' occupations. So then the next step is then to use individual Swedish workers, for instance, all workers' occupations are then used for linkage. So they are assigned these exposure levels. So all workers in one occupation, they get the same category of exposure or the same mean level of exposure. So this is the way you can do this. So it's not, we don't have the individual variation within occupations. We have the average level of exposure in the occupations. So we can have a variation of 400, for instance, or 350 exposure values, because that's how many occupations we have among the workers in our data sets of the total working population in Sweden. So here is how it looks in Sweden. We have earlier versions of job exposure matrices, and then we have relatively later ones. We are trying now to update after 2013, but we're not there yet because it takes time to develop these job exposure matrices, and we also have to know more about the quality of occupational reporting and information in Sweden, and also the response rates have gone down in the Swedish work environment surveys. So we only have exposure assessment for the period until about 2013, or they're relevant a few years after, of course. The working conditions do not change that much. Okay, so I will give you some examples of empirical studies that we've done and where we've applied this method of measuring or indicating people's exposures. And in several studies, we use something we call the SWIP cohort. So it's the Swedish Work, Illness and Labour Market Participation cohort. It includes all the workers in Sweden, if they were living in Sweden in 2005. So these are people born between from 1941 to 1989. Yes, and then they were 16 to 64 years old in 2005, which we usually use as the baseline year in our studies. So those people would be about almost 5.5 million individuals on the labor market in Sweden, and we also have them linked to their some parental information. So, for instance, we have their social background, the workers' social background, or their parents' occupations. So the SWIP cohort is linkages between many registers that are available in Sweden, including also, as you can see further down, some information from mandatory military conscriptions, even that. Importantly, we have we have sick leave and disability pension data. We have outpatient registers, so capturing all diagnosis of potential treatment for health and diseases in Sweden. Lisa is something that some of you have seen if you've worked on Swedish data. So it's labor market data that many epidemiologists and sociologists and economists are using in Sweden. So this is the data, and then we link through the occupations of the workers. We also link these exposure variables here during this period. So we link, for instance, the physical workloads and also psychosocial factors, measuring, for instance, decision authority and demands and skills discretion, as I mentioned previously. And then we study some outcomes that you can see here: long-term sick leave, unemployment, disability pension, early retirement, and also various diagnoses of interest. So one study was published a few years ago, and this was the first, I think, time we used the job exposure matrix measuring the physical workload. So the study in this study we explored how heavy physical workload might impact the likelihood of receiving disability pensions due to various diagnoses: musculoskeletal pain diagnosis, psychiatric, cardiovascular, and respiratory conditions. And as you can see, this was somewhat explorative. Yes. And we included those workers aged 44 and above, but still younger than 65, because that's when you during this period you could leave the labor market on an old age pension. So there were almost 2 million workers in this study, and again the possibility to study their working conditions was through this the use of these job exposure matrices. We looked at both. We looked at physical workload as the main exposure, but we also used job differences in job control as a potential confounding variable. So wanted to separate, or isolate the effect of physical workload. We did not use different dimensions. Instead, we used the summary of different exposure dimensions, related to physical workload. So it's an index variable that we used as a predictor in the study. And the study suggests, in conclusion, this study suggested that higher levels of physical workload significantly increased the risk of disability pension among the Swedish workers, and particularly for musculoskeletal disorders, but to some extent, though not as clearly, cardiovascular diagnosis and respiratory diagnosis as well. And let's see here. So these are some, so here are findings on female workers from this study. So what I show you here is that there's we're measuring hazard ratios, and if you're not familiar with that, they are the time when people are if there are the time when they received a benefit of a disability pension benefit, and then we take the ratio of these hazards across the physical workload groups here. So first you have disability pension without taking diagnosis into account, so they are all diagnoses regardless. So in the females with the highest physical workloads, they have 2 times the risk of or probability of having a disability pension as compared with the low exposed. But then we adjusted for various things, for instance, educational level here, and then also job control differences in this model. So we see that there is a substantial reduction in the associations between the models. So they are it's kind of a complex picture of different variables explaining why those with heavy physical workload have this higher risk of receiving a disability pension. But then we also see that when we look at disability pensions with musculoskeletal disorders, then we have a much stronger association. Yet this association is reduced when we take other factors into account. So this is just the picture for men, and here you see that a very strong association or huge differences between the low and high exposed in terms of physical workload when it comes to muscular risk of leaving the labor market on a disability pension benefit with due to a musculoskeletal disorder. But it's also again much reduced when we take other factors into account. Yes, I mentioned this study, so it's just another example of a study on this SWIP cohort. Then previously I did this study and I used some cohorts, so we can see it as a subset of the SWIP cohort, but it's not. It was done before we set up this SWIP cohort, but some people from this study would probably be in the SWIP cohort as well. The objective of this study was to determine the association between low level of education and increased disability pension rates, and whether they are due to differences in working conditions. we in this study we examined, or we studied men and women born in 1948 and in 1953 respectively, and they were almost 23,000 participants in this study. We linked data on education, occupation, and disability pension from various records, and again, to study the working conditions, we used the older job exposure matrices that I mentioned or showed you in pictures before. And the conclusion of this study was that physical workload and other working conditions, such as low job control, partially explain the higher rates of disability pension among individuals with low education, although other factors present from late childhood also play a role. So what we studied here, so here you have, at the left, you have 3 levels of education. And then we study the hazard or the time to a disability pension during the follow-up period. But for these cohorts, these 2 birth cohorts, we could also use some information from school. Because as I showed you in a graph early on, there could be confounders of the associations between education and working conditions and disability pensions, and selection patterns in the labor market. So we actually adjusted for paternal education and a measure of ambition to study or stop studying early, and also their intellectual performance in the 6th grade of school. And then we added the physical strain at work, and then added also the measure of job control to see what could possibly explain the differences between the educational groups in disability pensions. And what we saw then in these analysis, and I'll take this verbally because it's hard to explain everything here, but was that both these factors from childhood and the working conditions helped to explain the differences between the educational groups in disability pension risks. And it was held for both women and men in this study. So here are the women. So the conclusion of this study was that it's to some extent the working conditions and not least the physical strain at work that helps to explain why low educated workers leave the labor market on a disability pension benefit earlier. But it's also something going back all the way to school. And recently I was part of another study quite similar in design, first authored by doctoral student Emma Carlson, and you see some other names that were also in the other papers. This study had basically the same objective, although it looked not only at disability pensions, but also on other exit routes, other pension possibilities. They were men because they used military conscription data also linked to the other data. So they were 116,000 men born 1951 to 1953. And they were followed until they up on exits from the labor market until age 64. So early retirement, that is. And this study also found that physical workload and job control are important factors explaining educational differences. They found it for most early exit routes. And they also could, because of the availability of these detailed conscription data, they could still, with taking these potential confounders into account, they could still show that the physical workload and job control were mediating or explanatory factors in the association between low education and increased risk of leaving early. And they concluded that improving working conditions could help reduce inequalities in early labor market exit and could help to extend working life for the low educated. So you have the years of education here, and various models here, and mediating models of mediation. But so we could just look at, so here you have the percent explained, the percent of the differences between the low and high educated, and their risk of disability pensions. So 22% could be attributed to physical workload differences, and then in a confounding adjusted model, still 20% could be explained. And then they looked at long-term sickness absence in the old workers, and again 22% seem to be explained by differences in physical workload. Even more when it came, and perhaps surprisingly, when we looked at, or they looked at long-term unemployment in the older workers. So still that could be attributed to physical workload differences. And this is maybe something you would like to ask about and discuss soon. But it did not really help to explain differences in taking early old age retirement without income, because some did during the follow-up. So there are or were differences between the educational groups also in taking early or old age retirement during the follow-up period, but it could not be explained by working conditions. Okay, so I will end my presentation with these conclusions. So physically heavy work is an obstacle to work at an older age, and it's more common among the low educated. And we can measure in this way physically heavy work also in population studies. More physically heavy work among the low educated is part of the explanation for their early exit from working life, on average, but not for all exit routes, as you could see. But as one study showed, there are also other obstacles for the low educated, such as lack of jobs that do not require academic education. So, this is one way to say that if people, the low educated, would have to find ways away from the heavy physically heavy jobs, they would probably have to be reskilled, and then the problem is that many of the other kind of more sustainable jobs in terms of working longer, they do tend to require academic education. So this may also be a cause of early exit from the labor market. Yeah, something indicated by low education in itself. So here are some possible discussion points. Are the conclusions on working conditions that we showed here, are they valid? Do you think they are underestimated, or may they even be overestimated? Are there important explanations of the educational differences in risk of leaving the early labor market early? What policies could help low-educated workers to work longer? And are there other policy issues? So now I think I stop this sharing this.
Thank you very much.
Yes, I'll try to get out of this. Where do I have this? Yes, thank you.
Yeah, okay. Thank you very much, and for a great presentation. And a great presentation is always a presentation that raises questions, and in particular, the social scientist in me developed some questions, but these are not the interesting ones. Maybe the audience. I see many cameras switched off. Maybe you can switch off on your cameras again. That helps a lot if you want to start a discussion, if you dare to. I know some of us are sitting in home office, and yeah, thank you very much so far. Any questions? Just raise your hands. It's easiest for me to see then. But maybe I start with a question. Maybe then we can continue at least.
Yeah.
Because you have this.
Yeah.
You have your list of questions, and I have the advantage that I have your presentation lying here in front of me on the table. It's about the conclusions. Are they valid, or is there underestimation, or you said overestimation or so? And so just maybe a definition question. You talk about work conditions, but then the question is that work conditions, is the type of work, the job exposure, is this really work conditions, or is it just the nature of the occupational activity, and work conditions are more or less around this and moderate this? In other words, what is the role of the employer maybe in this, and also then of employer policies or workplace policies around it? If you look at the question, what policies could help here if we don't want to avoid to have these activities as such? So is your work conditions, is I understand it correctly, just the job exposure in the framework of the occupational activity, or is this maybe more? That could be subject of policy.
Yeah, I agree, and I can't really. I mean, that's in your question that we can't really separate this by using this method. We are of course we are using kind of a confounded measure to the extent that occupations share both differences in physical workload and employer policies and so on. We cannot separate this really, and that's also so I can't really argue against this, and it's also kind of an interesting methodological thing that when we try to separate physical workload from other aspects that we do measure also on the occupational level, for instance, then differences in decision authority, then maybe we are actually removing differences in physical, some details about the physical workload as well. So that we can't really know, I think, what is the exact number explained, so it's a crude way to do it, but it's a crude way to test whether these.
The crude way is so negative. I wouldn't say it's I think it's fascinating to see what happens if you take it from that perspective. It's just the question how to overcome how to handle, how to moderate the consequences if you ask for policies. Besides of avoiding that people have manual work. This is that's probably not what the goal could be. But looking for levels of interventions to moderate the effect that you see.
Yeah, I think it also this way of using data and analyzing the data might be kind of complement to the picture sociologists when they would, and the social epidemiologists that they are called, that would typically not adjust for job exposure matrix data, but they would adjust for some like occupational group data or social class, and by doing it this way that we did, then when we might add some details to the picture. That probably you, as sociologist, doing it that way would assume that they are capturing actually the differences in physical workload.
I would look would argue that of course that could be just be social class, as you said, or lifestyle or whatever what is behind. But this is the one part. The other part is of course the employer, or the branches and the employer interventions that they experience. So did these people who got an active improvement, or who experience active employer policies to smoothen the negative effect of the job exposure? And, of course, this is a little bit dreamland. We don't have all these data all the time, but at least the structural differences between types of employers could help to point in this direction. To make use exactly of this great job exposure data. So this is fine. So this is not too crude, but it's a good starting point. It's fascinating to read that, to see exactly these effects.
But it's true that you're saying. We know from other research that the ones who have these most problematic working conditions or heavy work, they tend to also to receive the least kind of interventions from the employers. As compared with those with initially quite good working conditions. If they have health problems, yes, the employer will tend to make adaptations to keep the worker in to a larger extent that they would do with the most exposed workers. They would just, or have been until now at least, removed, and you would employ new workers instead. Any other questions?
Yes, I have one. Thank you very much for your presentation. I would like to know if the data was analyzed by race and migration status.
We did not. No. This is, I don't know, and I can see here that Melody from my group is also here. I don't know if you remember if something was done outside of our group on this, or if
No, but I
Yeah.
think we pretty much always at least include country of origin as a covariate. But beyond that, I don't think that we have gone into detail. We don't have information on anything about race and ethnicity. The closest thing we have available in the registers is country of origin. And we have included that, but not focused on that particularly.
Yeah, but it's interesting because we know that there are differences between the Swedish borns would probably be different show differences between the educational groups or between different occupations, whereas in the immigrants in Sweden we have more of some occupations would that would be low qualified or deemed low qualified could still be including a lot of high educated workers in the immigrant group, which is not the case in the Swedish born group to the same extent. So there could be interesting contrasts to make with such an analysis that you suggested here.
We have a nice question from Loretta in the chat. Thanks, Loretta. And you point to the problem already in the beginning. I have a slightly complicated to explain question, so I thought I'd write it, but we have to talk about it. We can't give you a written answer. Maybe Daniel, maybe you can check it. Do you see the chat or?
Let me try to.
Otherwise, I can read it. Loretta wondered about the people in Emma Carlson et al. 20-24 study who took early old age retirement without income, which seemed to be a popular exit route. And if the question is if you have any idea about what might be going on there. And then there is in brackets an assumption. What do you think might be driving the educational inequalities in that early old age retirement without income group? And do you know who tends to make up that group? So, Loretta, I like your questions.
I'm reading it. I don't think we, and again, I might need to ask Melody for some support here, because you wrote the first study that I mentioned. We don't know too much about them, and it is kind of a mystery that they show educational differences that we can't explain with our data. So without income and what do you have any? I don't remember really.
Yeah, I mean, these are the ones, they take their pension early and they don't continue to work for income. So that's more common to do that than to continue working, though both are rather popular. But we tend to see that it's difficult to find things that explain differences here. I mean, we really don't fully understand. And I think it's partly because we really can't know anything about the motivations behind. I mean, for some people, it might be because they have the means, and they want to stop working for personal reasons, and for others, it might be maybe they have difficulty continuing to work for whatever reason, but take their pension because it's an alternative to, I mean, it's much more difficult to get disability pension, for example, than it used to be. And so I think it's a quite mixed group that we really have to admit that we don't fully understand.
Which came as a surprise, I think, because in the study you first authored, we had the hypothesis that when the disability pensions were taken away, we thought we would see that these people who were dependent on those in the low educated group, they would basically just take the money as soon as they could and leave the labor market. But we did not find for that outcome, we didn't find that. And as I showed you, they could not be explained by the differences in the working conditions, which we kind of thought they would, because we think we would see after the reforms the same patterns as were with the disability pensions, so that they just found new ways of leaving the labor market early. But we did not. So what we found instead was that the outcome of leaving on an early old age pension, but still earning money, was showed some of this. So then we think that and this is more like anecdotal, that there's a discussion of if the low educated workers or the manual workers kind of they actually have they take all the money they can as soon as possible, maybe also because they also have a shorter life expectancy, actually. So it could be kind of a rational thing to do to keep working to make extent, but also taking your retirement funds.
But you never looked at alternative sources of income, for example, right?
No,
so you never looked at partners, at wealth, at inheritances.
We did not have those linkages. So
but this is of course then also related to the educational level. That we know that wealth and inheritance is then for the lack of it. It's of course a burden for those that then depend on this employment income, while others can fill these gaps and maybe go on no income tracks for a while. And the same could be with partnerships and maybe also families of origin. So this is but at least that would be spontaneously my question to add that perspective.
I think it's
there you see, of course, these education the breaks between educational groups. So middle class can afford this, and usually people from in a low class context don't have these resources. Also outside their own resources. But just a guess. So this is. We have another question from Alex Murdoch. Did you distinguish between types of disability?
We did not. Yes.
So I can jump in, because when we include all disability pension, then it's any diagnosis, which includes both physical and mental. But in Daniel's paper, then you looked by specific diagnosis as well, and you showed the musculoskeletal related. But that paper also included psychiatric diagnosis, I think.
Yes, and also the earlier study where we tried to explain the educational differences, compared disability pensions with mental and with musculoskeletal disorders. But I think it's if I remember correctly, they are, which is also in line with the first paper I showed you, the results from the first paper I showed you, that it's as expected, the differences in physical workload are related or do explain the differences in disability pensions of the physical kind, or related to musculoskeletal disorders. So actually, in that the first study that I wrote and that Melody is talking about, then we showed that after adjustments, there were no association at all between heavy physical workload and disability pensions with mental health diagnosis. So, which you would, before adjustment, would find some differences as well, but there are correlations between heavy physical workload and things such as having little decision authority on the job. So which would be related to mental health problems.
Yeah, thanks a lot. And as you see, your studies raise questions, but not in a negative way. That is questionable. That it stimulates thoughts at least. And I think we have to think about it a little bit more. I think I think it's good to go further, but this perspective on the job exposure and the workload is essential, because that's usually missing also. Then we just look simply at structural differences. And yeah, well, if there's no more questions, we don't want to block you from.
And
there's an add-on to the previous questions, but Alex, you could raise this issue also directly. It's always nicer if you have a discussion with somebody who's talking.
I'm happy to do that. And I'm looking at this very much from the UK. The other thing that I wondered was about the impact of COVID, which caused what I would call the Great Retirement. And if this, I know Sweden had a different approach to COVID to other countries, but I do wonder whether if this data was taken during the time of COVID.
Unfortunately not.
Right. Okay.
So we are waiting for that data, and so during the next presentation, maybe I can
right. Okay. Thank you very much.
Questions about the COVID situation, but people were retiring, I guess, those who were near retirement age anyway.
At least from what we saw in survey data, it was not so massive as in other countries, at least.
Okay.
The effects on older workers, or at least those that declared themselves to be in these situations, were relatively small compared to younger workers, at least. And this is because of the relatively loose measures in Sweden.
Yes.
If you compare it to, for example, whatever, Germany or Italy or whatever, it looks quite different.
Yeah.
And but we got at least I heard that we got registered data now for our update for COVID until the most recent times, and now it's time to look at it.
Yeah, interesting.
That would be, of course, interesting to see what the effects are, and in particular if it stabilizes afterwards. So this is that there is COVID effects. It's probably quite clear, but what are the long-term effects? Does it go beyond 22?
No. Okay.
So that would be, of course, but something for the to-do list, definitely. Yeah, thank you very much, Daniel,
thank you.
and also Melody for the additional comments.
Thank you.
Thanks a lot, and hope to meet you soon. And I think we'll meet tomorrow anyway.
And if you have some more interest in understanding the job exposure matrices and what we have done here in Stockholm, you can just Google for job exposure matrices, Karolinska Institute, and you will find out more.
And then get in contact with you. And exactly. Thanks a lot for today. Thanks for the audience, also for the discussion and your patience, and to listen. And next time I think we don't have a proper planning, Gulin. Right? But we will
not yet. But
we will continue the series also after the summer. So that, but so far to be up to date means also to work a little bit and to plan at short notice. And so we will continue after the summer, probably October, maybe already September, depending on the planning. And hope to see you soon. Again, we will of course inform you, and you're on our mailing list and get an invitation. Yeah, see you soon. Bye.
Thank you.
Thank you. Goodbye.